safe and effective. That's what Pfizer and BioNTech are now saying about their COVID-19 vaccine. And this time they're saying it is safe and effective for kids ages 5 to 11.
Of course, this cannot come soon enough. Pfizer's CEO reports pediatric deaths, cases, I should say, among kids adds up about 30% of all new cases. Let's get to Dr. Larry Corey from Fred Hutch this morning. Talk to us about what all of this means. Dr. Corey, first, you've seen this press release from Pfizer. What are your first thoughts on this announcement?
My first thoughts, Jake, is that it really is good news. I mean, I think the data are about safety and the immune response. We don't really have, this is not an efficacy study to actually demonstrate that it has worked in 5 to 11-year-olds. What it is saying that the lower dose used, 10 micrograms, is giving the same immune response as the 30 micrograms did in the older kids as well as in adults. And it actually says that the safety profile looks a little bit better, a little bit less fever, a little bit less headache and reactogenicity at this 10 microgram dose than at the 30 microgram dose. So all good news.
Well, Dr. Corey, I know Pfizer has to go on and get their emergency use authorization and then soon apply for a full authorization later. When could parents expect to get these shots for their children? What does that timeline look like?
Well, Farah, I can't really know for sure. I would suspect that it'll be weeks, not months. I think we're in the midst of a Delta epidemic, and that's substantially creating the morbidity. 20% of the cases, maybe even more in some areas, are children. So I think we'll get an expeditious review of this, and I think the data, because of the immune responses, do correlate with effectiveness, that we should hopefully get extension of the emergency use approval like we saw a few months ago in 12 to 17-year-olds to 5 to 11-year-olds. I can't guarantee that, but I'm hoping for it.
Dr. Corey, some of the numbers, frankly, for me, were surprising to see just the amount of children that have been vaccinated. It's been relatively low. It was definitely slow to start. What are your thoughts about the confidence parents should have with this younger age group to get their child the vaccine when it does become available? Are you telling everybody it seems to be safe, nothing to worry about?
Well, certainly the assessment from 12 to 17-year-olds was the risk-benefit is really very, very substantive, especially during the epidemic. We'd be remiss to sort of say that, gee, there is this unique syndrome of myocarditis that is infrequent, seen more in young boys than in young girls. It's 3 per million in girls, and pretty close for the Pfizer vaccine to maybe 20 to 30 per million in the 12 to 17-year-old age range. It's self-limiting, but it is disconcerting. So one will have to see if this happens as a rollout, what we'll see, this lower dose, because myocarditis seems more frequent with Moderna and a higher dose. And this is than the Pfizer, the 100 microgram Moderna dose versus 30 microgram Pfizer dose. This is now a 10 microgram Pfizer dose, so we're hoping for lower cases of myocarditis. So complicated issue is yes, there is an uncommon side effect that may affect some parents, but yet the risk of COVID, including all the complications of COVID, is high in children at the moment during this epidemic. So I have elementary kids as my grandchildren. They fit. I have 4 of them in this age range. I'm going to recommend that they get vaccinated.
That's good to hear. And just to play off of that point again, the myocarditis is rare, 3 among a million, as you mentioned, very, very rare. 30% of all new cases are among children in this sort of age group. Are you surprised at the numbers you're seeing in terms of how fast this is spreading among the kids?
No, I'm not. Delta really is formidable. We are seeing an average of 1 person who's unvaccinated infecting 5 people who are unvaccinated as far as the sort of what we call the R0 or the transmission risk. And so we have this very large unvaccinated population in children. And so, and they hang out with adults. So we are seeing this epidemic in schools. We're seeing the schools disrupted. It is having both a medical and a social sort of impact on kids. And I think that's part of the risk-benefit ratio. That's one of the things that I think is important to get kids vaccinated.
Right, especially with school already underway and a lot of activities besides sports, things are coming up. This may be the answer a lot of parents and guardians have been looking for. Dr. Larry Corey from Fred Hutch, thank you so much for your time this morning on such what is likely to be a very busy day for you as all of us are learning more about this and asking a lot of questions. Thanks so much.
Thank you, Dr. Corey.
It's a pleasure with you. Thank you.
All right, we'll always check back in with him.
Absolutely.
Also, breaking news now, getting back to SeaTac Airport this morning. The White House just announced it is easing restrictions for international travel. Starting in November, foreign nationals traveling to the U.S. Must be fully vaccinated. A COVID-19 test will also continue to be required within 3 days of departure, and proof of negative test must also be shown. Again, this is international travel into the U.S. Enhanced contact tracing and masking will also be required.